This abstract was a collaboration with a multidisciplinary group to try to look at treatment resistance in advanced prostate cancer. There are multiple mechanisms of resistance that can happen as patients progress on our standard therapies. And in most cases, prostate cancer remains driven by androgen receptor signaling, and this has led to obviously the development of drugs that target the androgen receptor. But there are a proportion of men who develop AR-independent disease in later stages. And this means the tumors lose their androgen receptor signaling, even expression of the androgen receptor itself. And in some cases, this is associated with histologic transformation from a prostate adenocarcinoma to a small cell neuroendocrine carcinoma. And currently, when this happens, it tends to be quite aggressive, and usually if this is suspected, a doctor will likely do a biopsy to confirm the diagnosis and to look at tumor morphology. They look often like small cell lung cancers, and then we would treat them often like small cell lung cancer type with those kind of regimens. And so there are implications in identifying this subgroup of patients with advanced disease. But obviously tumor biopsies are invasive, and so we wanted to see could we detect molecular features of these neuroendocrine tumors using circulating tumor DNA. So before this study, we had done two tissue biopsy studies to try to understand what are the molecular features of these neuroendocrine tumors. They retain early prostate cancer genomic alterations, so they seem to arise from a prostate adenocarcinoma during the course of treatment resistance, but then they acquire new alterations in DNA and DNA methylation. But how and when these happen during the course of treatment has not really been established. And so again, this study was intended to see, can we detect these changes in circulating tumor DNA using a blood test, as one could envision. If you had a blood test to identify this could have significant implications. We also wanted to understand dynamic changes. When does this occur? What else can we learn by looking at liquid biopsies and studying tumor heterogeneity and distinguishing different mechanisms of clonal evolution? So that's really the rationale for this study.